Hello, everyone. My name is Matthew Fleischman. I'm a PhD candidate at McGill University in the Counseling Psychology program and a predoctoral intern at the Emotional Health CBT Clinic. I'm here today to talk to you about post-traumatic stress disorder, or PTSD. Before I begin, I recognize that this topic is particularly difficult for many people, especially right now in the midst of the current pandemic. So I want to thank you for having the courage and taking the time for yourself to be here to learn more about PTSD. This is the step that you're taking to help you heal, or maybe you know someone who's struggling to help them heal. To provide a very good understanding of what PTSD is, I will have to provide some examples and some content that might be upsetting or triggering for some. If you're feeling this way, I invite you to listen to yourself, step away from the presentation, and come back and join us again if you feel so inclined. Today's presentation will be divided into two parts. Part one will look at understanding PTSD, such as symptoms and who may develop it, some of the traumatic events that can occur. And part two will look at evaluation and treatment. So let's start with an understanding of what PTSD is. PTSD is defined as a mental health condition that's triggered by a terrifying event, either through experiencing it or witnessing it. If you have PTSD, or if you know someone who has PTSD, some of the symptoms that you might notice are re-experiencing the event through intrusive thoughts or memories or flashbacks, and during sleep, nightmares potentially. Avoiding reminders of the trauma is also very common. So avoiding the scene of a car accident, maybe at the intersection where it occurred. Or in the midst of our COVID pandemic, maybe you've been in the hospital yourself, or you have a loved one who is, avoiding that hospital, avoiding other medical care facilities because it's just too upsetting for you. PTSD is so pervasive that it can change your mood and your memories. So if you have PTSD, or if you know someone who does, you may notice some of those mood changes. Maybe they're a little more quick to anger. Maybe they're a little grumpier. Maybe they're having trouble remembering parts of the trauma, or you're having trouble remembering parts of the trauma. This is all very common. Of course, experiencing a trauma or witnessing a trauma, learning it's happened, can be very anxiety provoking. So increased anxiety and increased emotional arousal is also part of the symptomology of PTSD. And emotional arousal simply means someone is likely to get startled a lot more easily, or maybe more things startle the person or startle you compared to pre-trauma. So to diagnose PTSD and other mental health conditions, mental health professionals use something called the Diagnostic and Statistical Manual, or the DSM. And in the DSM, it states that these symptoms have to last more than 1 month and cause impairment in daily functioning. If these symptoms have lasted less than 1 month, they of course are no less distressing and of course deserve attention. Um, During this less than 1 month period, it's likely you might have acute stress disorder. If the symptoms continue past that 1 month, then it's possible you have PTSD. We all know that everybody experiences trauma in one way or the other. In a typical response, these symptoms will alleviate and diminish on their own. But for someone experiencing PTSD, these symptoms will be pervasive and will continue uh, to be part of one's daily life without professional intervention. Many of the symptoms I've discussed have been psychological in nature, but I want to take a moment to recognize that if you're feeling some physical changes in your body, maybe extra tightness or aches or pains, this can also be a good indicator of the presence of PTSD. So this list here is, of course, by no means an exhaustive list of traumatic events that can contribute to the diagnosis of PTSD. But as we're in the midst of a pandemic, I want to take the time to focus on interpersonal violence and medical catastrophes. So interpersonal violence can be sexual assault, physical assault, domestic abuse. Because we are being encouraged to self-isolate, stay at home more, for many individuals, this unfortunately may mean being home in an abusive situation where the exposure to abuse is more frequent, and maybe more intense as stress levels are high across the board right now. If you are someone who is currently experiencing domestic violence or sexual violence, or you know someone who is, I encourage you to please seek help. There are some resources at the end of this presentation that can help you connect to professionals who can get you the assistance you need. Medical catastrophes, of course, are going to be very prevalent right now and very relevant. Something like being put on a ventilator yourself, or seeing someone you really care about being put on a ventilator or passing away as a result of COVID, can be very traumatic. For those individuals out there who work in the medical field or our first responder communities, uh, being exposed at a higher rate to individuals experiencing COVID can also be quite catastrophizing in terms of the medical sense, and can be quite traumatizing. I want to take a moment to distinguish PTSD from adjustment disorder. Right now, we are in the midst of a period where we had to go from normalcy to abnormal very quickly, and a lot of people are having trouble adjusting. Adjustment disorder pertains to these symptoms such as depression or anxiety around things that we might expect, for lack of a better word of putting it, in our day-to-day lives. So divorce or job loss. PTSD refers to those events that are considered abnormal, events that we don't expect to encounter throughout the course of our lives, such as a pandemic, such as assault. And this is where the distinction happens, is between the types of events and how expected or quote unquote normal they are, even though those words are not necessarily appropriate to describe them. They're the best words we have to sort of distinguish between the two. PTSD can result either from you directly experiencing the event, or if you've witnessed it or learned it's happened to someone. This is very important to recognize, that maybe some people watching are feeling like, I don't deserve the help. Even though I'm distressed as a result of this event, it didn't happen to me. So, why should I go seek help? You are very much deserving of help, as is the next person, as is the person who experienced the trauma, because this is affecting you. So please, if you are in distress and you feel that you need help, I encourage you, go seek it. You do deserve it. PTSD can also develop from being exposed repeatedly. It does not have to be a one-off exposure to a trauma. So for example, first responders and medical staff, first of all, if you are watching this, thank you for everything you are doing right now. Being repeatedly exposed to these traumatic events, such as seeing people on ventilators, people passing away, can also contribute to PTSD. If you've been exposed previously to a trauma, especially in childhood, it's likely that PTSD will develop as a result of a trauma, and the symptoms might be more severe. So noting any traumas that you've had in the past will be important to talk to with your therapist, and I'll touch more on this down the line in the presentation when I discuss evaluation and treatment. Certain types of traumas will disproportionately result in a PTSD diagnosis. So, for example, sexual assault. And as a result, women tend to experience PTSD more than men, because women tend to be on the receiving end of sexual assault, physical assault, more than men. Of course, I don't want to diminish the experience of any men out there who are watching, or if people watching know of any men who have been on the receiving end of domestic violence or sexual violence. Please encourage those gentlemen out there to get help if they need it, or if you are someone who's watching this right now and you have been on the receiving end of this, I of course encourage you, go get help. Your experience is no less simply because of your gender. There are three types of factors that will inform PTSD diagnosis. The pre-traumatic factors refer to those that are there before the trauma. So, of course, with mental health, genetics always plays a role. So, what is your genetic makeup? But also, what kind of environment are you in? Are you in a supportive environment, or is your environment a little bit more chaotic? Do you have access to resources such as mental health care or medical care? Do you have access to supportive friends, family members? Peritraumatic factors are those that occur during the trauma. So it's not uncommon during a traumatic event for people to dissociate, to feel disconnected from their bodies or their surrounding environments. This is the mind's way of protecting itself. If you've experienced the trauma in the past, how closely does this current trauma resemble that past trauma? These are some questions and some factors that need to be considered when looking at PTSD. And of course, what's available to you after the trauma? Do you have any physical injuries that have to be addressed? Do you have access to proper care to get those injuries looked after? What kind of support system do you have to help you? All three of these factors come together to shape the severity of PTSD and the types of symptoms you may experience. Along with re-experiencing the trauma through flashbacks or intrusive memories, it's also not uncommon to experience anxiety and depression and maybe increase substance use to help deal with these distressing feelings and sensations. I also want to take a moment to discuss suicide. Unfortunately, it's not uncommon for individuals who have undergone significant trauma and who have developed PTSD to think about suicide or to attempt suicide. If this is something that's happening to you, or if this is something that you know is happening to someone else, please consult the resources at the end of this presentation and seek the appropriate help. In an emergency where any of these resources aren't available, of course, please call 911 or go to your closest emergency room. So you're here today because you're curious about PTSD, you're wondering if you have it, if someone else has it, and maybe you've decided it's time to explore treatment, or at the very least be evaluated. Speak to someone. What's that going to look like? Evaluation and treatment usually consists of 7 steps. So it's going to start with step 1, evaluating the symptoms and associated factors, getting an idea of what the traumatic event was for you, what are the symptoms that you've experienced since, and some of those pre-traumatic factors as well. You're then going to go sort of through this list to work on psychoeducation and working on thoughts and feelings, learning some coping techniques. And then at the end of therapy, you'll take a step back, learn how much you've grown and developed, and learned what coping strategies do you have to help with relapse prevention. So step 1 is evaluation. This is likely going to occur during the first session or maybe the first couple sessions with your therapist, in which you'll have the opportunity to briefly discuss what happened during the trauma and how have you been functioning since. It's really important that during this time that while it may be tempting, and understandably so, to really get into sort of the weeds of the trauma story, that you just provide a very general summary to your therapist, because during the initial sessions, this is the time where you're getting to know each other. And discussing the trauma without allowing the appropriate time in session to process it and work through it may leave you feeling more distressed at the conclusion of the session. So a very brief summary so the therapist knows sort of what you've been through. In terms of level of functioning, this pertains to everything from sleeping and eating patterns to how your relationships have been impacted, how has work or school been for you. Have you had any thoughts of suicide, or have you attempted suicide? The pre-traumatic factors are going to be very critical as well. So what was available to you beforehand, such as resources, and have you been through other traumas in the past that may be informing your experience of this trauma or maybe making it worse? How has it affected your partner, your family, your work relationships? And of course, all of this can be very much gleaned and discovered through a more informal or semi-formal type of interview with your therapist. But it's quite possible that you'll be asked to fill out a couple questionnaires. And these questionnaires are research-informed tools that can help you and your therapist have a much more concrete understanding of how severe your symptoms are, how long they've been impacting you, and what specifically in your life they have been impacting. Psychoeducation is a key part of a lot of therapy, and this is really just a fancy way of saying you'll be provided with information around the reason you're seeking treatment. So in this case, PTSD. Providing an understanding of what PTSD is in terms of symptoms and what it does to the mind, to the body, understanding and being reminded that this is a normal reaction to an abnormal event, and examining what is some of the blaming that may be happening, either that you're engaging in for yourself or you may be experiencing from others. So I want to take a moment to discuss this because it's important. Victim blaming is something that others do to make themselves feel safe because they're vicariously becoming distressed from the trauma. So, for example, if someone's been sexually assaulted or physically assaulted, victim blaming might look like, how much do they have to drink? What were they wearing? Reaction blaming is a type of victim blaming that asks, what did you do during the trauma to help mitigate it? So someone who engages in reaction blaming might ask, what did the person scream? Did they fight back? Did they try to remove themselves from the situation? It's especially important for you to know that you did whatever you had to do in that moment to survive. If you're here, you survived and you did well. So it's really, really essential you remember that you're here, you're seeking help, and this is the first step to that help. Consequence blaming looks like reassurance from loved ones who want to help but don't know how. So things like, it's been 3 months, I'm sure you can go back to work now. Or if you're still struggling, just wait, time heals all. These are well-intended statements, but I'm sure they're very dismissive and they don't really make you feel like you're being heard or understood as to really what you went through. Another part of psychoeducation is understanding why you reacted the way you did during the trauma. During the event, your body will have kicked into that fight or flight mode, doing whatever it had to do to preserve itself, whether that be physical safety or mental safety. So maybe you dissociated, or maybe this adrenaline rush got you out of the situation so quickly that you were feeling shaky afterwards. This is an extremely powerful motivator that your body naturally engages in to try to ensure survival. And if someone hasn't been through the same situation, or even if they have, everyone's situation and how they respond to it is very different. So the blaming I just discussed may lead to feelings of abandonment or solitude, feeling powerless, humiliated. These are all things that the therapist will help you work to address and to understand that what you're feeling is not your fault. It's a very natural reaction to the event that happened and a natural response to people who might be talking to you in a way that is not sympathetic or empathetic or understanding. Part of doing this is going to be through emotion processing. Emotions play an important role in how we think and we behave, and by processing the emotions, it will diminish those PTSD symptoms. A lot of this can be done by expanding what is known as your window of tolerance. So your window of tolerance is this yellow zone here where you feel like you can deal with whatever's being thrown your way in life. For individuals who have been through a trauma, such as yourself or maybe a loved one, you might experience less time in that zone and maybe more time in the hypo-aroused, so feeling zoned out or spacey, or the hyper-aroused, being anxious or angry or out of control, or maybe you're bouncing between the two quite frequently. Emotional processing will help to reduce the time spent in the red and blue zones and more time in the yellow zone, and it will help increase the yellow zone's physical space. This emotion processing is not about controlling your emotions. It's about recognizing the role they play in our daily life, in our functioning, what emotions can tell us, what they can inform us of, whether threats or other scenarios that might require immediate attention. They can also motivate us to take action. So taking the time, think about what made you come online today to listen to this presentation. Were you feeling sad or frustrated or angry? Maybe you were feeling fed up and you just wanted to find a way to start to regain some control of your life. and emotion processing will help you gain some understanding around that. Part of emotion processing is going to be getting in touch with your body. So your mind retains a lot of the symptoms of the trauma, but so too does your body. And I'm not just talking about the physical injuries that might have occurred. I'm talking about aches and pains that may not have been there before, tension in parts of the body you may not have had before, and then connecting these two together, recognizing why your body's feeling achy or sore in terms of the connection to the trauma and the emotions that are maybe feeling some of those bodily sensations, and accepting your right to feel that way, to feel sad, to feel scared, knowing that because you're feeling that doesn't mean you're weak. It's, again, that normal response to an abnormal situation. And expression of these emotions can look very different. They can mean crying or screaming, learning to communicate to others. So that could be communicating to others in a way that explains, maybe you're engaging in this blaming and it's not helping me, it's hurting me, or communicating to yourself, engaging in some self-compassion. And sometimes other types of therapies can help, such as writing a letter, or writing out the trauma story so you can see it from a different perspective, can also be part of emotional processing. A key component of a lot of cognitive therapies, or most cognitive therapies, is working on thoughts. These automatic thoughts are the ones that come to mind without a prompt or just without any effort on your part. These can be around the cause of the trauma, the symptoms, any perceived role you feel you had in it. The automatic thoughts may also be around core beliefs that you feel have been shaken. So by these core beliefs, I mean beliefs that you hold to be true, that you connect with on a personal level, such as the world is a safe place, or I'm healthy, I can't get sick, or my friend is healthy, he or she can't get sick. In the context of COVID, experiencing maybe being in a hospital or witnessing someone be in a hospital goes against these core beliefs of yours. And PTSD develops when we come up against the conflict of how is a good person experiencing something that no good person should experience. And this is where the rift sort of presents itself. As part of the trauma healing process, working to regain a sense of security, safety, power, and control, as well as self-esteem and intimacy, is going to be a critical part of that therapy. So the automatic thoughts can feel like they're dominating your life, they're controlling you, they're navigating your life for you. So switching the role and the power dynamic, putting the control back in your hands rather than in the power of thoughts. To do this, you will engage in cognitive restructuring. And cognitive restructuring is just a fancy way of saying, let's rebuild the thoughts. So a good example could be you have a home that's crumbling, but you need a place to live. So you tear it down and you build a new home with a solid foundation, solid sides, a roof that doesn't leak, a place that you feel safe to live in and that you can feel comfortable in. Cognitive restructuring will likely be around thoughts around the world is extremely dangerous or what happened was my fault, and engaging in different exercises to help you realize that the cause of the trauma was not on you and you had no part in perpetuating the trauma. And with other people telling you that you did or you're somehow responsible just serves to hurt you, and learning how to address that with them and to address that within yourself so you don't internalize it as much. Engaging in self-compassion. As mentioned before, our bodies retain a lot of the daily stresses and traumas we undergo. So exercises such as deep breathing or progressive muscle relaxation, meditation, yoga may also be discussed with you during therapy to learn how to slow down your mind and slow down your body so your body can become relaxed and your body learns how to be relaxed again. There are two types of exposure therapy that you may encounter as well. The first is in vivo, and this simply means in real life. This could mean going back to the scene of the trauma, whether it be a hospital or a car accident. This could be done with your therapist or for your home practice. By going back to the scene of the trauma in a safe environment, this will desensitize you to the danger. And this is, again, just a fancy way of saying you will learn that this particular spot or location is not dangerous. As you keep revisiting in it with the absence of danger, your mind starts to, okay, this is just another intersection. Or the hospital, this is a place where I can go to get help rather than be a place of fear or anxiety. And over time, with that repeated exposure, that anxiety will diminish. And this will be done slowly over the course of a number of sessions. So you will work very slowly to climb that ladder to reach that level of competency and feelings of control. Another type of therapy exposure therapy you might engage in is imaginal. And the rationale behind this is sometimes we cannot get back to the scene of the trauma. There's a multitude of reasons. Maybe the scene no longer exists, or you physically just can't get there. Imaginal exposure requires you to bring the scene into the therapeutic setting. So taking yourself back there, usually by closing your eyes. What are your senses telling you? What did you see? What did you feel? Touch, taste. And throughout the course of your therapy, you will be prompted for more details and you will learn to connect more with the symptoms of the trauma and the story of the trauma, but in a safe environment. So again, you start to feel safe and learn that you are in a safe environment where the trauma can no longer hurt you. At the end of the day, this is all done through a procedure or a process called emotional digestion. And a great way of thinking about this is looking at a messy desktop. So say you turn on your computer for the day and you have documents and folders just spread all across your computer. It's anxiety provoking, it's distressing, it's overwhelming. You just want to avoid it. And by avoiding it in the short run, that alleviates the distress, the anxiety. You don't have to deal with it. But then you go back to your computer and it's going to come back again. So the only way to alleviate that is to take the time, spend a couple hours, reorganize your desktop, get rid of documents that are no longer relevant, organize your folders, maybe relabel some of the folders so you can find information faster. And once that's done, you'll feel a lot more relaxed, calm, and control. And that's what emotional digestion and these different types of exposure therapies do. They help you organize your psychological desktop, make you feel more in control and more organized. And it will give you emotional closure on what happened. Throughout all of this, you will be reminded that you are not alone. It's so easy to feel alone during difficult times, particularly after you've experienced the trauma. Remembering you are not alone. There are so many people out there who are undergoing similar situations as you, and feeling connected to them can help you feel grounded and to feel a sense of community. Recognizing the different emotional and cognitive states between the trauma and now when you're in therapy, seeing what comes back to you, what's different, and learning how to engage with those differences, with those distressing emotions through relaxation and self-soothing techniques. And learning that while anxiety is uncomfortable and it's distressing and nobody wants to feel it, anxiety in itself is not dangerous. It's there to inform you of something. It's there to inform you of a danger. And this exposure will recalibrate your mind and your body to tell your body, okay, this sense of danger was there, but it no longer is there. And the anxiety does not have to kick up anymore. By the time therapy concludes, you'll have seen symptom reduction. You'll see yourself feeling less controlled by these symptoms. Maybe you're sleeping better. Maybe you're eating better. Maybe your relationships have improved. You're noticing a lot of these positive changes. You're able to go back out and re-engage with your life in a healthy, productive manner. You'll notice that you've grown, you've evolved, and particularly important, you'll have these tools to prevent relapses, especially around the anniversary of the trauma, or maybe you've just had a particularly difficult week that may make you more susceptible to feeling anxious or traumatized again, drawing on this toolkit to help you in the future. So I know this presentation was heavy, it contained a lot, it was exhausting. Thank you for sticking it out with me. I really hope it was informative. I hope it helped you understand maybe what you're going through or what some other people are going through. If you have any questions, please email me, matthew.fleischman@mail.mcgill.ca. You can also join me later on the clinic's Facebook page. I'll be doing a live Q&A. And if you need some resources, as I mentioned throughout the presentation, please consult these different services and they can help you. So thank you again, and I look forward to seeing you later this evening around 8 o'clock on the clinic's Q&A.